Cardiovascular system consists of heart and vascular system. Vascular system is divided into two, which is systemic circuit and pulmonary circuit. Systemic circuit is a circuit that transports blood to and from the rest of the body. The pulmonary circuit is a circuit that transports blood to and from the gas exchange surface of the lung. Blood is carried through the three medium, which is arteries, veins and capillaries. Arteries carry oxygenated blood from the heart, meanwhile veins carry the oxygenated blood to the heart. Capillaries is a small, thin wall vessels that connect the smallest arteries and the smallest veins. The thin walls permit the exchange of nutrients, dissolved gas and waste product between the blood and surrounding tissue. Next, we move to the heart. As we know, heart plays an important role in our body because heart never rests. Heart beats approximately 100,000 times each day and pumping about 8,000 liters of blood. Heart has four chambers, which is right atrium, right ventricle, left atrium and left ventricle. The right atrium receives blood from the systemic circuit and pass it to the right ventricle. The right ventricle receives blood from the right atrium and pass it to the pulmonary circuit. Left atrium receives blood from the pulmonary circuit and pass it to the left ventricle. Left ventricle receives blood from the left atrium and pass it to the systemic circuit. And the cycle continuously happens. Heart also has four valves, which is tricuspid valve, pulmonary valve, mitral valve and aortic valve. The function of all of the valve is to maintain one wave continuous flow of the blood through the heart to the lungs and the rest of the body.
Valvular stenosis is the stiffening of heart valve can narrow the size of the valve opening and restrict blood flow. The narrowing is called valve stenosis. It keeps the valve from opening fully and reduces the amount of blood that can flow through. Tricuspid valve disease is a type of heart valve disease. The valve between the two right heart chamber, that is right ventricle and right atrium, doesn't work properly. As a result, the heart must work harder to send blood to the lungs and the rest of the body. Pulmonary valve stenosis is a narrowing of the valve between the lower right heart chamber and the lung arteries. In a narrowed heart valve, the valve flaps may become thick or stiff. This reduces blood flow through the valve. Usually, pulmonary valve disease is caused by a heart problem that develops before birth. A heart problem present at birth is called a congenital heart defect. In adult, pulmonary valve stenosis may be a complication of another illness. Mitral valve stenosis, sometimes called mitral stenosis, is a narrowing of the valve between the two left heart chambers. The narrowed valve reduces or blocks blood flow into the heart's main pumping chamber. The heart's main pumping chamber is the lower left heart chamber, also called the left ventricle. Aorta valve stenosis, the valve between the lower left heart chamber and the body's main artery, is narrowed and doesn't open fully. This reduces or blocks blood flow from the heart to the aorta and to the rest of the body.
The next one is valvular prolapse. So prolapse is a condition when the valve flaps slip out of place or form a bulge. This can lead to improper or uneven closure of the heart valve. There are four types of valve prolapse, which is the mitral valve prolapse, tricuspid valve prolapse, pulmonary valve prolapse, and aortic valve prolapse. So for the mitral valve prolapse, part or all of the mitral valve bulge upward into the atrium when the two ventricles contract. This can allow a small amount of blood to leak backward through the valve. Mitral valve prolapse is also called Crick-Palmer syndrome, Barlow syndrome, or floppy valve syndrome. Tricuspid pulmonary and aortic valve prolapse are less common than mitral valve prolapse. Similar to mitral valve prolapse, the leaflets of the valve do not close completely and fail to form a tight seal.
Tricuspid valve regurgitation is a type of heart valve disease in which the valve between the two right heart chambers, which is right ventricle and right atrium, doesn't close properly. As a result, blood leaks backward into the upper right chamber, which is right atrium. As we know, valvular heart disease is a congenital heart disease. A person may be born with tricuspid valve regurgitation. However, tricuspid valve regurgitation may not cause symptom or require treatment. Medication or or surgery may be needed if the condition is severe and causing signs and symptoms. When the heart skips, the right ventricle, which is the lower right chamber, pumps blood out into the pulmonary artery. The pulmonary artery then takes the blood to the lungs. The pulmonary valve, sometimes we call it the pulmonary valve, is located between the right ventricle and the main pulmonary artery. Its job is to prevent blood from leaking back into the heart between beats. Pulmonary valve regurgitation occurs when the pulmonary valve doesn't completely close and allows some blood to leak back into the heart. This condition is also known as pulmonary regurgitation, pulmonary insufficiency, and pulmonary insufficiency. Pulmonary regurgitation can be categorized as mild, moderate, or severe. Mitral valve regurgitation is a type of heart valve disease in which the valve between the left heart chambers doesn't close completely, allowing blood to leak backward across the valve. It is the most common type of heart valve disease. If the leakage is severe, not enough blood will move through the heart or to the rest of the body. As a result, mitral valve regurgitation can make you feel very tired or short of breath. Other names for mitral valve regurgitation are mitral regurgitation, mitral insufficiency, and mitral incompetence. Treatment of mitral valve regurgitation may include regular monitoring, medication, or surgery. Some people with mitral regurgitation don't need treatment, especially when the regurgitation is mild. Severe mitral valve regurgitation requires a catheter procedure or heart surgery to repair or replace the mitral valve. Without proper treatment, severe mitral valve regurgitation can cause heart rhythm problems, arrhythmias, or heart failure. Aortic valve regurgitation or aortic regurgitation is a condition that occurs when your heart's aortic valve doesn't close tightly. As a result, some of the blood pumped out of your heart's main pumping chamber and leaks backward. The leakage may prevent your heart from efficiently pumping blood to the rest of your body. As a result, you may feel fatigued and short of breath. Aortic valve regurgitation can develop suddenly or over disease. Once aortic valve regurgitation becomes severe, surgery is often required to repair or replace the aortic valve. The echocardiogram is the most common test to diagnose a problem with the heart valve. Radiography or echo is a painless test that uses sound wave to create moving pictures of your heart. The pictures show the size and shape of your heart and how well your heart is pumping blood. A type of echo called Doppler ultrasound shows how well blood flows through your heart's chambers and valve. Echo can detect blood clots inside your heart, fluid build up in the pericardium, the sac around the heart, tumors, and problem with the aorta. The aorta is the main artery that carries oxygen-rich blood from your heart to your body. Echo also can help your doctor find the cause of abnormal heart sounds such as heart murmurs. Your doctor also might use echo to see how well your heart responds to certain heart treatments.
The next one is a chest X-ray. A chest X-ray shows the size and shape of the heart, lung, and large blood vessel. It can show whether a person has the following signs of heart valve problem, which is the enlarged part of the heart, calcium deposit in the heart, and also fluid build-up in the lung. All of these can be signs of the heart valve problem. A chest X-ray helps the healthcare professional learn the type of valve problem, how severe it is, and whether there are other heart problems.
The first one is MIR11003 syndrome, a genetic disorder that affects the body's connective tissue. Connective tissue holds all the body cells, organs, and tissue together, including in the heart. People with MIR11003 syndrome may develop mitral valve prolapse and aortic valve regurgitation. The second one is age. Heart valve problem may result from degenerative changes or normal wear and tear of aging.
Rheumatic fever usually start as strep throat or an infection involving strep. Heart valve may be damaged or scarred as the body fights the strep infection. The next one is infective bacteria endocarditis. Common germs can travel
show you something, and I would like to give you some suggestions. So based on the X-ray image, we can diagnose you that you might have a vulvular heart disease. So this is a few treatments that I can suggest you. This treatment depends on your symptoms, the severity of the condition, and whether the condition is worsening. This will provide your care. Treatment might include monitoring the condition where regular follow-up visits. You might be asked to first make healthy lifestyle change, and then take medication to treat symptoms, and then take blood thinners to reduce the risk of blood clots if you have a certain irregular heart rhythm called atrial fibrillation. I think that's all for a few suggestions that I can suggest you to. I hope you can follow up with the next session.
Doctor, lastly, I feel shortness of breath.
Oh, I think you might have a vulvular heart disease. So maybe you can go for treatment. The heart valve problem can be serious if it's not treated. Although you can undo damage to a heart valve, you can treat the issue. Heart valve disease treatment depend on the underlying cause and may include first protecting your valve from further damage, taking medication, and then having a surgery or reversing procedure if necessary, and then seeing your heart doctor for regular visits. And the decision to prescribe medical treatment, surgical repair or surgical replacement depends on several factors, including the type of valve disease, the severity of the damage, your age, your medical history. So if you are pregnant and have a heart valve disease, you can get extra rest and take certain medicines that are safe for your baby. If you know about your valve disease before pregnancy, you should ask your healthcare provider if any tests or visits with a cardiologist are recommended before trying to become pregnant. This can help ensure that you are treated appropriately before and during pregnancy. If you have a severe valve problem, your doctor may recommend valve repair or replacement before pregnancy. So I think that's all.
Alright, thank you, Doctor.
Thank you.